Hi, Dina.
We're all set.
Okay. Welcome to fantastic Dr. Mimi Guarneri, and today's talk is about healthy people, healthy planet, our responsibility. So everybody here knows about Dr. Mimi, but I will tell you about her anyway. She's an international renowned integrative cardiologist and the president and founder of the Academy of Integrative Health and Medicine. And she has a long list of other things which you can see on her website, and also on Pacific Polar website, which is an integrative center she runs in La Jolla in California. There are also two books which I highly recommend, one is called 108 Pearls, and her very first book, which is called The Heart Speaks, which is about her transition coming from Western medical doctor into becoming an integrative, looking at the world and medicine and people from an integrative point of view. So in the chat box, we'll put up Dr. Mimi's website and also the Pacific La Jolla website. So, because it's full of resources, and there's also daily affirmations which you can receive from the Pacific Pearl La Jolla website, which I find are really wonderful. My personal interaction with Mimi as a doctor was after I had gone through cancer and cervical cancer and treatment, and had a radical hysterectomy. And there was not one doctor who had warned me about the hormone imbalance that one experiences after surgically induced menopause. And I was struggling for months and months, completely out of my mind. And Mimi looked at me in one glance and said, "Natalie, what you need is bioidentical hormones." And within, I would say 48 hours, I actually returned to being back into my mind again. So that is how sharp Mimi's eye is in terms of understanding what a patient needs. So I feel very emotional when I say that, because it was a very important time in my life. So I'm going to pass you on to Mimi before I start to cry. Thank you very much, Mimi, for coming, and it's all yours. Also, sorry, Mimi will be talking for 30 minutes, and then we'll have a Q&A afterwards. So please put your questions in the chat box, and Sonia will be mediating them.
Om Namo Narayani. Thank you, Natalie. Om Namo Narayani. We'll put up a few slides because I'd like to tell a little story. And because this is about Green Shakti, I feel like we need to talk about the planet and our role in planetary health. So we'll throw up a few slides here and take you on a little bit of my journey, which some of you know about, of course, and some of you may not really know much about. So let's do that. So many years ago in the 90s, I started my career in what's called the cardiac cath lab. And in that lab, I would look at arteries like this, and you guys can see a blockage in this blood vessel. And to be honest, my only interest at that time was to open arteries with tools and things like stents. Well, for some reason, I can't move the slide, but we'll try a different way. There we go. So fixing an artery like this is great work, but what it's not doing is curing cardiovascular disease. So that very much set me on a journey to start asking some deep questions, because this gentleman, you can see some wires here, had already had a bypass and was already back with new blockage in his arteries. So the journey got me to realize that in conventional medicine, the kind of medicine I learned in medical school, we're really great at doing things like surgery and acute care, making quick diagnoses and diagnostics, but we're really, quite frankly, terrible at preventing disease and creating health. How do we get people healthy? So even though we do over 500,000 bypasses and millions of stents each year, the World Health Organization still reminds us that cardiovascular disease can be completely preventable. 80% of the deaths could be prevented by how we live our life. And that how we live our life is really a body, mind, spirit experience, because it's not only about the foods we put into our body and our physical activity, but it's also how we respond to stress and tension, the toxins we're exposed to, and so on. This is a very busy slide, but for those of you interested in global health, the Lancet published this in 2016, looking at the comparisons between the 1990s on your left and today on your right, showing what is the world suffering from. And by and large, the world is suffering from what I like to call the diseases of excess, high blood pressure, diabetes, obesity, and so on. And these are the things that are by and large preventable. But we have another struggle right now that the Lancet also reminds us of, and it's a struggle around the health of our planet. This quote came out of the Lancet a couple of years ago, and they said this: climate change is the largest health threat in the 21st century. But they went on to say that it is one of our greatest opportunities. And that's what I'd like to focus on today from a cardiologist perspective. How is this affecting the people I see in my office, and how is it affecting the world? And where are the bright spots in the world? So if you take a look at what we are actually seeing right now, we have come to realize that air pollution claims 7 million lives a year. Some of the places with the highest air pollution are places like Delhi, India, and Santiago, Chile. Not to mention, those are probably number one, and number two, right, with Beijing, China, right? We're also starting to see diseases that we never thought we would see in such high numbers as a result of warmer weather. So diseases like malaria and dengue, chikungunya, West Nile virus, which were actually limited for many years to the tropics, are now starting to spread north. We're even starting to see things like Lyme disease in Canada, where we never saw that before. Climate change is, of course, affecting our food supply, particularly in regions of Africa and regions of India, where the drought conditions are such that food simply is not growing and is not going to grow. And the extremes of heat claim hundreds of thousands of lives. And the extremes of weather, we know, result in loss of homes, loss of communities, fire, floods. I mean, Chennai had floods, San Diego had fires. So the mental, physical, emotional aspects of all of this are quite sad and quite devastating. And so as a world, we need to be working together to solve this problem. Well, I'm not going to spend a lot of time talking about toxins, but it's important to know that just like air pollution causes stroke and cardiovascular disease, so does exhaust from vehicles, but also so does heavy metals and mercury, lead, cadmium, for example, linked to heart attack and stroke, linked to diabetes and cancer. So the kinds of toxins we have in our water, the toxins we have in our soil, are fundamentally making us sick. So it's not so easy anymore to say go out and exercise when we have a much deeper rooted problem that we need to address. In many places, India included, we've done something that I like to call good intentions but dangerous consequences, where we have decided we have to feed the world, but the plan is to feed the world using things like CAFOSs, where animals are cramped into small spaces, fed hormones and antibiotics. In the United States, the subsidizes livestock industry up to $8.6 billion over the last 10 years or so, which to me is, quite frankly, a waste of taxpayers' money. You may have seen in India some of these chicken trucks driving by. And of course, Gandhi reminds us that the greatness of a nation and its moral progress can only be judged by the way its animals are treated. And this, to me, is one of the best reasons, aside from Mama telling us to be vegetarian, to be vegetarian. The agricultural industry has changed the world, and it has changed the way we grow our food. Monocultures replace biodiversity. We're just going to grow corn, or we're going to grow soy, and we're going to put that corn into high fructose corn syrup, and we're going to add it to everything, adding calories and weight to humans, contributing to the obesity. So around the world, we have some major problems. Bangladesh has been flooded so many times that they no longer build the children's schools back. They actually have the children learning on boats. They have 40 school boats with computers and libraries, solar lamps, and so on, so the kids have light. And one of the things we do have to face, and this is coming from the world's climatologists, is that there's a good chance Bangladesh will go underwater. And the question is, where do all those people go? That's the big question. Well, Tuvalu is in the same situation in New Zealand, but it's much smaller, of course, than Bangladesh. There's only 11,600 citizens in Tuvalu. And Tuvalu has actually cut a deal with New Zealand, where they can become citizens of New Zealand when their island goes underwater. So this is where we're at in the world, and this is our reality on the planet. We may have to bring back something like the Nason passport. For those of you not familiar with this, after the war, Nason, who was from Norway, was trying to help people who were refugees of war-torn countries. And so a passport was created that allowed refugees of war-torn countries to be able to go into any country and at least have a place to live. And I think climate refugees are going to have to face a similar circumstance. So when we think about the origin of disease, we talk about blood pressure, cholesterol, things like that. We also have to think about our environment, our exposure to chemicals, the foods we eat, the emotional traumas we sustain, and then some of the obvious things, smoking cigarettes, exercise, how we respond to stress and tension, all of these things. This is the soil of our life. And unfortunately, our soil is very contaminated in many places. But this is what determines and interacts with our genes and determines whether we remain healthy or we become ill. I thought, in light of what's happening in the world today, I would talk a bit about the impact of racial bias as well as a risk factor for disease. This was a fascinating study that looked at African American men who lived their life with discrimination and racial bias, actually showing that their telomeres, which monitor your longevity, the more racial bias you are exposed to, the shorter your telomere length. And we know this, the more stress someone has, the shorter their telomere length. And that's very, very telling. We also know that community is fundamentally important, and that's why I'm so happy to wake up and be with Amma Yagam in the morning and to be here with all of you tonight, because this is our community and this is our spiritual family. And what the research shows is that social connections, having friends, family, colleagues, improve our odds of survival by 50%. And if you want to compare that to some more traditional risk factors, it's about equivalent to not having some connection is equivalent to smoking 15 cigarettes a day, being an alcoholic. It's more harmful than not exercising and twice as harmful as obesity. So the connection is powerful, powerful medicine. So I was trained to think about the world this way in silos. You know, I'm a cardiologist, so I should only treat the heart. The neurologist should only treat the brain, and so on. And these silos have gotten us to a world where we have this ill to the pill mentality. And I have spent probably the last 20 years of my life through the Academy of Integrative Health and Medicine, really working to retrain the way clinicians think and to educate clinicians in preventing disease and creating health, as opposed to just saying, you have high blood pressure, take this pill, you have diabetes, take that pill. I know many of you are not in the United States, but this is the US cost of healthcare. And if we slide down here, this is the UK and Finland's cost of healthcare. And it's not like in the US up here, we're living to 140, we're actually living a shorter time, and we're spending way more money because we're spending it on end of life, and we're spending it on chronic disease, and we're not putting any money into preventing disease. And we spend a lot of money on pharmaceuticals, and I thought you guys might be interested in this. A country like Finland, Roundy's country, is here, and the US is way up here, where you have Sweden and the Netherlands down here, living as long and not using so many drugs. So from a climate perspective, how do I put this all together? Well, in the US, we subsidize some really bad things. We subsidize the meat and dairy, the agricultural industry, and this industry actually makes us sick. We have KFOSs, which have now been linked to antibiotic-resistant bacteria, food that's filled with high fructose corn syrup. We have animals that are being given steroids, and we give more antibiotics to animals than we give to humans. Humans then consume this food and obviously end up needing clinical intervention in the healthcare system. The agricultural industry is also responsible for the greenhouse gas effect with significant methane emissions. And then we decide to go over to the pharmaceutical industry on the other side to help us with our health impacts. But the pharmaceutical industry also has a huge impact on greenhouse gas emissions. So everything that we're doing becomes this sort of vicious cycle where we subsidize the wrong things, we are polluting, we're creating greenhouse gases, we're making people sick, we're sending people to the healthcare industry, and then the healthcare industry is making people sick as well. And this is the pharmaceutical footprint here for the UK, which is a huge carbon footprint from the pharmaceutical industry. So I look at it this way. I think we do have a tsunami, and that tsunami, I think COVID may bring to a head, because COVID may force, at least in the US, the system to think differently. You know, we know that 70% of chronic disease is how we live our life, what we eat, who we live with, how we think, what's our attitude, what's our connection. We know that for certain. And we know our genes are important, but they're just the tip of the iceberg. Really, 70 to 90% of the things that we encounter from a chronic disease perspective are related to our environment, our air, our water, our toxin exposure, and our lifestyle. Thomas Edison said this: the doctor of the future will give no medicine, but will interest her or his patients in the care of the human frame, in a proper diet, and the cause and prevention of disease. Well, that sounds about right to me. Two quick studies. This is the Amish community who was studied because they happened to have the obesity gene. And when they went in and they evaluated this community and they published this data in 2008, they concluded that the reason these individuals with the obesity gene don't have obesity is because they walk 17,000 steps a day. Likewise, Dr. Ornish did some very interesting research with men with prostate cancer. And if you look on the left, everywhere you see red, that's a cancer gene that's turned on. And these men were taught yoga, meditation, vegetarian diet, group support, and exercise, and 500 cancer genes were downregulated. And for those of you who don't know, Ornish got all of his principles out of India. Yoga, meditation, vegetarian diet. He was a devotee and is a devotee of Satchidananda. So that's where that came from. I met Ornish in the 1990s, where we did the same thing for heart disease. And if you look here on the left, you can see an artery blocked. And if you look a year later, it's the improvement is significant. And the blood flow on the left was where you see black is no blood flow. On the right, you see full blood flow to the heart muscle. And that's all through lifestyle change. And that's really where I got my first introduction to vegetarian diet, yoga, and meditation. Well, Pope Francis has been pushing the climate issue. His Laudato Si is called On the Care for Our Common Home. And I just want to point out one of his quotes. He said, "The same mindset that stands in the way of making rational decisions to reverse the trend of global warming also stands in the way of achieving the goal of eliminating poverty." It's all linked together. Quite frankly, the poorest are suffering for some of the privilege that many of us enjoy. But I do believe we are at a tipping point. And that's the good news, because lots of things are happening in the world, including right at our own Puram, that are making a tremendous difference. The World Health Organization has called for a traditional medicine strategy and has asked member states to develop policies to bring back traditional medicines into the culture. In India, which is very big and involved in this strategy, you may have heard of bringing Ayush back into the Indian culture. It's just like bringing back Siddha medicine and Ayurvedic medicine, yoga and meditation, and so on, trying to embed this into everyday life. The UN is on board telling us these are the top goals for the UN: to end poverty, to end hunger, to focus on good health and well-being, clean water and sanitation. So the people that are sitting at the top, whether it's the World Health Organization or the UN, they get this. But the question is, how do we get the corporations and the people who are making money on, quite frankly, making many people ill, to think differently? This is the UK's roadmap to health. I love it. I'm totally aligned with it. The new highway says to bring healthcare back into the community, to focus on prevention, to look at health and well-being, not just to look at sickness, right? To create health. What's also fascinating to me is that the roadmap to health is calling for healing environments, a balanced use of resources. Right now, we do not have a balanced use of resources, and focusing on returning people back to health as opposed to just focusing on procedures. And from a climate perspective, calling for sustainability to be integrated in everything that we do, not just sustainability as an add-on or lip service, as frequently happens. So at the Academy of Integrative Health and Medicine, we have been teaching exactly this, teaching clinicians to focus on creating health, physicians that have learned conventional medicine to really focus on mind-body medicine, nutrition, nutraceuticals. Many of these clinicians are trained in Ayurvedic medicine through our efforts, traditional Chinese medicine, and so on. It's a movement that we need to really continue. We just published Health of People, Health of Planet, and Our Responsibility. You can download this entire book for free. Jamie Harvey and I have a chapter in here, and this came out of our work in the Vatican. For those of you who don't know Ramanathan has been part of the Nobel Prize team, and he is a devotee of JAMA. So it is through Ramanathan, who's considered one of the countries or the world's leading climate change scientists, that I've been connected to this work. And you can download that for free. From a medicine standpoint, I think we need to move from an ego-driven model to an ecological model. And what do I mean by that? The ecological principles of medicine say, and this may not be a surprise to you guys, that the first goal is to establish conditions for health and wholeness and prevent disease and illness. The second goal is to cure. The earth is also our climate because humans are part of this ecosystem. And we're seeing how a sick ecosystem, whether it's waterborne illness, pollution, heat, climate, weather changes, or all of the chikungunya and mosquito vectors making people ill, it's a disturbance in the ecosystem. Medicine in general should not address the illness of humans or the earth as an add-on. It needs to be a priority, and we should not add to the illness of people, which quite frankly, we are doing. The precautionary principle says that science and industry must assess the impact of their activities before they impose them on the public and the environment. This is a principle of ecologic medicine. So there are some wonderful models for change. I'd just like to share a few. And these are models I share when I lecture all over the country. This is a Nuka system in Alaska, where the community was so sick and diabetic and obese and alcoholism, and nobody would go into the healthcare system. So the community took over ownership of the healthcare system. The result was unbelievable. A reduction in ER visits by 36%, 93% customer owned, 95% employee satisfaction. This is a new and ambitious model of community health care. In California, we have the Fresno Health Commons. In Fresno, California, we have a lot of poor people, and this is the bread basket, one of the bread baskets of the US. So here are these people struggling to put food on their table, yet they are providing food for the rest of the world, for the rest of the country. So the community food system was created to have people farm, process, and distribute the food, to sell the food in the surrounding areas, and to put the money into a nonprofit trust so everyone in the community benefits from it. It's a brilliant model. The nation called this a radical shift from a production of food on its own toward a whole system approach in which the interests of farm communities, local people, the land, and biodiversity are all considered together. And this very much sounds like what's happening at Puram. Community-supported agriculture continues to grow. Farmers markets continue to grow. I think the message here is we have to know what we're buying, and we have to have conscious capitalism. The more we have conscious capitalism, the more we can change the communities around us. The healthcare system are huge contributors to climate change. Hospitals in the US, for example, produce 2.3 million tons per year of garbage and waste. And organizations like Physicians for Social Responsibility, Healthcare Without Harm have done amazing work at trying to, we used to burn IV bags in incinerators and just release that plastic into the air. That doesn't happen anymore. So lots of changes and more to come. Hospitals are beginning to purchase local, sustainable, organic food. They're actually doing a movement toward meatless Mondays. And this is a case study of the University of Washington Hospital, which was able to cut their greenhouse gas emissions by 11%. So change is happening. It's just, can we get it to happen fast enough? In Boston, the hospital basically has now become 100% carbon neutral, and this is a huge cost savings. So I love to tell the world the Green Shakti Sri Puram story, because I think it's, you know, when we took Ramanathan, Rowney and I took Dr. Ramanathan to meet Amma, and he saw the whole recycling program and the food program. He said there's nothing like it in the world. And so one of my goals is to go out and show it to the world. So how do we bring food to thousands of people that are grown right on the land? How the push has been to go from what we see, fire burning stoves, to a solar kitchen. Many of you donated to make that happen. These were in our younger days, Natalie, you, Rowney, with, of course, Amazama, planting trees at Kamala Nivas. And look at the difference in these two photographs to show where we were and where we are. And this, Natalie, by and large, with Amma's blessing, is due to your amazing, amazing work. So thank you. Turning garbage into gold. I mean, where does this happen where there's zero waste? Really nowhere in the world. Nowhere in the world do we see this kind of composting happening. So at the end of the day, I want us to realize that we are all stakeholders in changing the health of our planet, and we can do it in every way possible, from something as simple as not using plastics, single-use plastic, to something as simple as being a vegetarian, to something as simple as supporting the work that's happening at Puram with Green Shakti and other places that may be in your world and around you locally, supporting CSAs, supporting organic farmers, making decisions to purchase things that you know are certified humane if you happen to eat eggs or whatever it is that you do, but to really think consciously. We have a very small window right now to bend the curve by 2 degrees. We are at 1.5 degrees. And I have placed a lot of my energy as a clinician now into climate justice, into educating people about what we can do, everything from good food purchasing to ownership, right? Like the Fresno food commons, to eating less meat, to going more to an ecological healthcare model. It's all connected. It's not just a silo. Everything that happens to the web of life. I was very happy to see this Moral Determinants of Health come out in the Journal of the American Medical Association just within the last month. This was a call for the US for the realization of healthcare as a human right, a call for the US to ratify human rights treaties and the conventions of the international community, a call for US leadership to reverse climate change, a call for radical reform of the US justice system, to end hunger and homelessness, and to have compassionate immigration reform. These are some of the things that those of us living in the US are struggling with right now, but it affects the world. So Pope Francis said the economy should not be a mechanism for accumulating goods, but rather the proper administration of our common home, an economy where human beings in harmony with nature structure the entire system of production and distribution in such a way that the abilities and needs of each individual find suitable expression in social life. And all I can say to that is Om Namo Narayani. So Thank you for your attention.
Thank you so much, Mimi. That was fabulous. A lot of information and a lot to process, and some wonderful tips. If anyone has any questions, feel free to type them into the chat box. Mimi is happy to address them. Maybe I'll start us off, Mimi. When you were talking about toxicity, and there are moments where that feels quite overwhelming. So I think many of us don't even realize how toxic we all are. What do we do about this?
Well, I think, Sonia, we take the steps that we can take, right? We have to think locally and of course act globally, right? So the steps that we can take are going to range from everything from growing, if we can, growing some of our own food. If we can, purchasing certain things organic. If we can, not being, one of the problems we have is this consumerism, right? Everyone is just buying stuff. And when I heard one of my colleagues 10 years ago say, don't buy a new table, repair the table you have, right? So we need to really look at our life and say, what can I do that's not going to impact the climate footprint? What can I do that's going to transform my community? How can, simple steps like the plastic. I mean, the plastic is one of my pet peeves. I mean, it's everywhere, right? It's in the Pacific Ocean everywhere, and it's in our food, and it's in the fish, and it's killing the albatrosses. So, steps that we can all take can make a huge difference.
Great. Let's see if anyone else has any questions. Mimi, you didn't speak much about personal supplementation and looking at supplementation and thinking, will this help with depletion, with toxicity? Because in terms of consumerism and excess, this other side to supplementation also seems dangerous in terms of its consumption and the degree of which people are consuming supplements.
Yeah.
What's your view on that?
Well, it's a great question. So you have to say most of the soil right now is depleted of its micronutrients. So most of the soil is depleted of its chromium, its magnesium, its manganese, its copper, its zinc. Where does that come from? You can pick foods that are going to give you lots of your nutrients. Green leafy vegetables, for example, filled with magnesium, filled with calcium. Some people need a good multivitamin. For those that are really concerned, they can do a simple blood test that tells them what nutrients they need, something called a nutrient evaluation. And then we can tailor the nutrients to what someone actually needs, as opposed to just taking everything. The research also shows that toxins can be removed from the system. What do I mean by that? A very interesting study was done on children, where children were found to have high levels of persistent organic pollutants, and they were put on organic fruits and vegetables, and the organic pollutants, when remeasured, had come significantly down in the kids. So and if you can't afford to buy everything organic, you buy it, you go to the EWG website, which I recommend to everybody, Environmental Working Group, and you look at what's on the Dirty Dozen list, what's on the Clean 15 list, and then you know what you absolutely need to buy organic and what you don't have to buy organic. So what you put into your body is important. If you do a hot sauna every day, for example, or you go into the steam box in the Ayurvedic Center, you're pulling heavy metals, cadmium in particular, right out of your skin. So there are many things that we can do that don't have to be huge. And, I'm happy to talk separately about how to determine what nutrients you need and what supplements you need. But, we are depleted in our soil today.
Mimi, what do you see as the relationship between coronavirus and the future health system and the health of the planet?
Yeah, I think what we've learned is that, again, the poorest are suffering because people have been underserved. And again, I can speak mainly for the US, but people who have been underserved and have not had health care are more likely to have things like diabetes, high blood pressure, things that are untreated. And so we're seeing underserved communities with the highest death rates. And so what it is pointed out globally, that the model, certainly in the US, is not working, right? We need a safety net. Many countries have safety nets. They have universal health care. They have public health programs. Speaking to the US, we do not have that safety net. And that's why we are seeing so many of the underserved community having the highest death rates at this time.
There's a question about engaging children in this dialogue from an early age. What are your thoughts on that?
I think it's great. I mean, I have friends who have children that go to Steiner School, for example, and which is part of the anthroposophical medicine movement. And the children, and largely because of the parents, right, are so educated on sustainability. I mean, they came to my house and they bought me a big bar of soap, and I said, this is great. And they said, now you don't have to use soap in the plastic. This came from 2 6-year-olds, right? So educating, and you have to educate teachers to educate children, right? It's the same thing with nutrition. You have to educate the parents, you have to educate the children, you have to educate the teachers, and we're just not putting enough emphasis into that. Again, that's where it all begins, right? And children should have, just like we have the Green Shakti doing planting the trees and connecting the children to nature, connecting the children to earth, that should be happening everywhere. Teaching the children to not use plastic, that should be happening everywhere. Teaching the children about alternative forms of energy, the solar panels, the wind, and so on, to walk. Simple things, walk and don't use your car, I mean, if you have an electric car, great, but making decisions like that, not only is it good for your health, it's good for the planet's health. And we've got to do this. And we need, at least in the US, again, we need legislation that stops selling bad food cheap.
Right.
That's why I put tax sugary beverages on there, which is a big battle right now. But, you can buy a box of cereal that's this big and it's all full of sugar and, simple carbohydrate, and it's just not healthy. So, we have a world that's frequently right now overfed but undernourished, and also undernourished spiritually. Yeah. Right? And when the world is undernourished spiritually, the end result is people keep looking to fill the void with food, with alcohol, with purchasing things, and that's unfortunately the world that we're living in right now.
Mimi, when you say go organic, there's a question about whether it's okay to take some plant-based supplements to balance the daily diet.
Absolutely, especially if you're eating a plant-based diet, you most definitely are going to need a B vitamin, particularly B12. Absolutely, 100%. And if you are eating a plant-based diet, so B's are necessary. And not to make the mistake, I see many unhealthy vegetarians because they just eat carbs and cheese, right? It's just rice and pasta and cheese, and they're not eating legumes and lentils and sprouting their beans and making bean stews. And I also frequently have vegetarians make an organic pea-based smoothie, you know, with some extra protein, and just so they get extra protein if they need it.
So I think we have a question from Ito who says, who would like to ask it actually. So Ito, if you'd like to unmute yourself.
Yeah, hey, sorry, it was a bit too hard to type it because it's a bit long-winded. Mimi, can you guys hear me?
Yeah.
I've been following a lot this Dr. Zach Bush from Hawaii. I don't know if you know him, and he says a lot of the same things you say about the relationship between the earth and health. And one of the things he's saying about COVID is that there's a direct correlation between the PM 2.5 and all the toxicity in the air, that what actually we're seeing is that the COVID bundles all this pollutants in the air and makes people more susceptible to them. It's not actually a viral infection, and that this whole hypoxic nature that people present with, like ventilators, is the worst thing that you can do for that. Like cyanide, people are coming like with cyanide poisoning. What do you think about
Well, I think we don't know. You know, there's a lot of COVID theories out there, but viruses have been around for a really, really long time. Whether it's the influenza virus, the mononucleosis Epstein-Barr virus, so they've been around for a long time. I think on a much deeper level that we have lost touch with our higher consciousness, and we have on some levels manifested this. It's almost like this great equalizer right now, where it's bringing everyone sort of to their knees. It doesn't matter how much money you have, it doesn't matter anything. It's like everything, it has forced us all to stop and say what matters most, right? Why am I flying to meetings all over the world? Why am I not doing my meetings with Zoom? What it's gotten people to, I think, look on a much deeper level about their relationships, their family, their connection. It's gotten people to get out of gyms and walk outside in the fresh air and in nature. Our air pollution is much better since COVID has come in. So I feel like in some level, energetic level, this came in to almost save us from ourselves, if that makes any sense, you know? And it does, because you look and you see the air pollution levels coming down, you see the animals coming back out, you see all sorts of people. In my practice, people losing weight because they're not eating out every night of the week, they're not drinking when they eat out every night of the week, they're walking every day. I mean, so, you know, it's really changed things. Whether or not Zach is right, I don't know the answer. I do know this. I know Wuhan, China, for a fact, has a level 4 microbiology lab. And that level 4 microbiology lab has been studying coronavirus for many, many, many years. Probably one of the world's leading coronavirus authorities works in the Wuhan lab. So I find it no coincidence that that lab is sitting there where people are manipulating viruses, which is another lesson to us. Why do we need to be manipulating viruses, right? Why are we doing this? Yeah, I mean, this is all about, I'm sorry to say, biologic warfare, which goes on. It exists. It exists right here in the US. We are manipulating viruses. And we need to learn that we can't do this. It's just not acceptable. And again, I think we're seeing the consequences of that.
Yeah.
Thank you, Mimi. Do you, there's a question about harm to health from measures imposed in reaction to COVID. So there's a concern that there are lots of alienating measures, especially with schools being, you know, and small children, and it's a major factor in health.
It is social isolation. I showed the slide on social isolation in part for that reason, that it is a major factor on health. And children need to be with children, and adults need to be with adults, just like we're coming together right now. Even if it's on a Zoom, we get to see each other and connect. You know, many people will have COVID and never get severely ill. And then some people get obscenely ill. And in the US, our death rate is about 150,000, which is, when you think that the Vietnam War, which went on for how many years, was 58,000, it's kind of scary.
And we don't even understand the damage.
And we don't understand it. That's the problem, where it's like, from a medical perspective, every day we're trying to figure out what should we do. The death rate in the US has come down significantly because we're learning how do we deal with this thing. I mean, New York, for example, the people died because the hospitals just couldn't handle it. It was completely overwhelming. And then your doctors are getting sick, your nurses, your respiratory therapists. So at the same time, as I think everyone needs, now, if we were in a perfect world, I would say, okay, let's test everybody before they go into the school. Let's do a 10-minute test and see, is anybody positive for COVID? You're negative, you're negative, you're negative. Go in and have a good time. We don't even have that technology to help us to do that. And better yet, if in Japan, they had really not COVID. And they did it by no close crowds, limited social contact, no more than 3 people, but they had contact tracing. So if somebody got sick, they knew everyone who was in contact with that person. And we don't have a handle on this. India doesn't have a handle on it. The US doesn't have a handle on it. So that's why to freely say, let's open up everything, there's that level of concern.
You know, I was really struck by your slides on Bangladesh, and it reminded me that the UN called the 21st century the century on the move. I think that we are underestimating how serious this is, and how close to a reality this is in terms of, major displacement and a refugee crisis like we've never seen, that would make COVID pale in comparison.
Yeah, I just think about what's happened. I mean, did you ever think you would see Katrina hit the US the way it did, to the point where we're questioning whether it's worth rebuilding New Orleans, right? Or should people just not live there? So we're seeing this all over the world. Chennai had no water. Natalie can, for how many weeks? Can you imagine Chennai having no water? So I find it, I know nobody wants to deal with this. I know everyone wants, like COVID. Nobody, all right, I'm done with that. Let me go to the restaurant. But the reality is we all have to do our piece because it's here and it's real.
Okay, I think we've run out of time, Mimi. But thank you so much. We've still got a few more questions, but we, I want to thank you so much, Mimi, for your time. I want to thank Sonia also for moderating. Thank you very much. And thank you everybody for coming. And we're going to be putting this talk on YouTube on the Green Shakti channel. And we look so forward to seeing you next month, Mimi. And thank you so much for sharing all your wisdom and the insights, and for giving a global point of view, and also seeing seeing what we are doing at PDM, because it's great to be able to also see that in a global perspective too.
Thank you so much, Natalie.
Thank you, and thank you everybody for coming today. This is a by donation this talk, so you can go to the link where you have the Zoom link, and you can donate to support the green workers during COVID. So this is keeping everybody in jobs during COVID. We're employing everybody in the recycling, in the tree planting, and in the caring for cows and the picking up the rubbish. So every donation counts. Thank you so much for everyone to come. And we shall send you out just a copy of the links from today, so that you could, because that book that Mimi mentioned is very, very worth reading. So we'll send you those links too. Thank you.
Thank you,
Oh,
everyone. Thank you, Mimi.
Thanks, Sonia. Bye-bye.
Good to see you all.
You all. Bye.
Lovely to see everybody.
Love to everyone.
Bye.
Bye, Canada.
Love you.
Love you too.